hair loss during chemotherapy is something which is inevitable. It happens. And let us know what is the fact, what is the myth, and what are the facts of the hair loss during the cancer treatment, I should say. So here the number one thing is, all cancer treatments do not cause hair loss. So hair loss happens in conventional systemic chemo, and hair loss does not happen in targeted therapy treatments or immunotherapy. So there are many safer chemotherapy options like the protein bound, albumin bound nanoparticle chemotherapies, wherein hair loss is very, very minimal, not the complete. Complete hair loss happens when the conventional chemotherapies are used for treatment. Now, what is this hair loss and why does it happen? I mean, why does the hair loss happen during the cancer therapy? Is something that we should understand, and then we can embrace and see the positive side of it. Yes, there are positive side of it. So what happens is, cancer treatment involves use of very strong drugs like chemotherapeutic drugs, which are very strong. They kill the fast multiplying cells in the body. The chemotherapy is killing the fast multiplying cells. Mostly the fast multiplying cells in a cancer patient are the cancer cells. Cancer cells are multiplying very fast. Chemotherapy is going to attack the fast multiplying cancer cells. In this process, what happens, when it is attacking the cancer cells, it also attacks the normal fast multiplying cells in the body. The normal fast multiplying cells in our body normally are the scalp and the hair. The skin comes the next. So the hair is a very fast growing and fast multiplying area. So definitely hair growth is affected, and there is inevitable hair loss during the cancer therapy. Now this is actually a sign of improvement, because if there is hair loss happening, if the treatment is working very well with the conventional chemo, there is bound to be hair loss, and hair loss means that the treatment is effective. It is an indirect way to assess that yes, the treatment is effective. So that doesn't mean that if you don't have hair loss, your treatment is not working, because all the treatments of cancer do not cause the same amount of hair loss. Now this hair loss, we should take it in a positive way, but yes, for the patient, if you see, there will be depression, the body image issues, and for females especially, it's a big thing, because hair is supposed to be the crown on the head, and they're very fond of taking care of their hair and all, right? So hair loss definitely brings down their body image issue support, and they feel low about themselves, that something is missing, and they feel incomplete about it. So here I would like to tell you that this is a temporary phase. It is not permanent. This is something that you have to remember. Hair loss is temporary, it's not permanent, it is reversible. What does it mean? As soon as your treatment is over, the main chemotherapy is over, your hair growth will start. And the hair growth takes about somewhere around 4 to 8 weeks to initiate, and it does come back. In fact, we have many patients who have told us that it comes back fantastic, and it comes back even better than before, more denser, and they sometimes get curly hair, and they really grow back very well. Now, what is the reason behind the fantastic hair growth after the completion of chemotherapy? Is something scientific, because post chemo, the plasma of the patients, cancer patients, will be rich in platelets. It's called platelet rich plasma, PRP. Platelet rich plasma is actually a therapy for hair loss, which is very, very costly in the cosmetic industry, and this happens naturally to a great extent post chemo for all our cancer patients. So definitely the hair growth post treatment is very, very nice. It comes back beautifully. So hair loss is a temporary phenomena, and it's not permanent, it's reversible. Now to combat these body image issues and to come out of the depression and worry of the hair loss, there are many ways that we have programs to counsel patients how to develop or how to maintain their body image. So one is use of wigs. Wigs are very safe, they can use them. Or if you don't want to use the wigs, a beautiful way of tying the head or the scalp with a nice scarf or beautiful caps or hats. So you can do it by many ways, and just remember that it's temporary phase, that's it. And nowadays the fashion industry also welcomes the bald and go bold and bald, right? So the bold and bald beauties are also coming up. So there's nothing wrong in having that. It's just a temporary phase. It's how you look yourself in the eyes of the person in the mirror. So how do you look? What's your attitude? If you're feeling very low, then definitely the bald head will also make you feel low, and it's vice versa too. I know it's very easier said than done what patients undergo, but I do understand to a great extent. I always motivate them that it's a temporary phase, temporary phase, temporary phase. I would like to repeat again, it's a temporary phase. It's not permanent. It's all going to come back, and it's temporary, and all therapies do not cause hair loss. So forget about this side effect, and be open to receive the therapy with a very positive and happy attitude, and then only you will get the maximum benefit from your therapy. Thanks a lot.